to slide number 3 in this lecture about PTSD and personality disorders. Um, Other symptoms of PTSD include re-experiencing the event that was horrific in nature. For example, a person may experience spontaneous memories, recurrent dreams, flashbacks, intense or prolonged psychological distress, and so on. Many people will that are reminded by things that that cause great distress will use the term being triggered. So being triggered is a word that is being increasingly used to talk about people who may hear someone uh, make reference to something or say something that reminds them of something very unpleasant or very horrific. And it can range from something that's just mildly disturbing that can nevertheless disrupt a person's life to something that reminds them of something very, very traumatic. So, any kind of a trigger is something in the environment, and it can be just about anything, that reminds the person of something that they have experienced that was very negative. For example, if a person walks into a room and sees walls painted entirely in the color red, and that person had had a exposure to something very violent that had happened to them when they were younger, and they may have seen blood on the wall. The color red on the wall could be very triggering for them. So I use that as an example, not just because that's a good example of something that links the two together, but I've had patients who have experienced those kinds of traumatic triggers before. All it took for them was to walk into a room. They would associate that with something very violent that had happened, and they would immediately start to imagine that they were experiencing the trauma again. So, this re experiencing of the event that's mentioned here in the first bullet point is a way of describing how a person who's not in any kind of threat or any kind of danger can nevertheless feel like they're back in the midst of the trauma. And so they start to react very negatively. And they exhibit typical symptoms of people who are in the midst of something very frightening. They have lots of sympathetic nervous system arousal. They have, uh, for example, some aggressive or reckless or self destructive behaviors that can happen. Their sleep might be very much disrupted, and they might be in a state of what we would call hypervigilance. So, chronically being awake, alert, on edge, very tense, and not really able to calm down. When you try to soothe someone who's experiencing um, a, a re experiencing of the event, or maybe a flashback of the event, it's very difficult to calm them down. So, as a result, in their day to day lives, because they know that they might be triggered in some instance, they will often avoid reminders of those kinds of events. So, for sufferers, they may not be spending a lot of their days in the midst of a flashback, but because they know they might have a flashback, they'll go out of their way to avoid things that could trigger them. In addition, they will often not only physically avoid these kinds of reminders, but they'll use alcohol to try to numb themselves so that they're less likely to be triggered. So, one thing you really want to look out for in PTSD is the use of alcohol. Well, that's important because a lot of drugs that people take to try to calm down with PTSD are contraindicated with alcohol, which could make taking alcohol with these drugs very, very dangerous. In particular, a benzodiazepine drug or a barbiturate class drug. PTSD sufferers often experience negative thoughts and mood. They can also have negative feelings. For example, they might have a persistent, distorted sense of self blame, blame of others for what happened, a sense of estrangement, which refers to feeling distanced from other people that you would normally be in close relationship with. There may be amnesia or even selective bits of amnesia where only parts of the memory are intact but other parts of it are lost. Or there could be examples of a more generalized amnesia where large chunks have been erased from a person's memory. And there's also a loss of interest in that which is normal, a loss of interest in normal activities, a loss of interest in normal foods that a person would like to eat, a loss of interest in hobbies or things that they would normally enjoy. And then What often happens too is feelings of helplessness or powerlessness in the face of the trauma. So, one very, very primitive way to deal with something that's overwhelming is to kind of curl up into the fetal position and pretend as if you're completely helpless and overwhelmed. Sometimes it's thought to be a survival instinct. For example, a predator might not attack someone who's just curled up into a ball um, and let the person go. And so sometimes people just feel so overwhelmed by how frightened they are with the trauma that they become almost unable to move or frozen or just curl up into a ball because they're in such an overwhelming state of fear. Moving on to slide number 4, um, there's another diagnosis that exists in the DSM that you need to know about, and that's called acute stress disorder. And the chief difference between post-traumatic stress disorder and acute stress disorder is the length of time. So any cluster of symptoms that last less than 1 month, that's called acute stress disorder. And any cluster of symptoms that is lasting longer than 1 month is PTSD. Now, the onset of PTSD can be acute or delayed. So that doesn't mean that a person needs to start suffering from symptoms or exhibiting symptoms immediately after they've gone through the trauma. Sometimes the trauma can be very much delayed. One example I remember my friend telling me was he went to a concert, and after the concert was over, he and a group of people in his car were in their cars trying to get out of the parking lot of the stadium. And because there was a large traffic jam and cars weren't moving anywhere, they became a very easy target for someone who held them up at gunpoint. And all of their wallets were stolen, and they could do nothing because they were all in their cars. And everybody else was in their cars as well, and so people felt very helpless. So anyway, about 2 hours later, after they finally had gotten out of the parking lot and were driving down the highway heading toward home, each of the person in the car had a delayed panic attack and delayed panic response. So there were 4 people in the car, and they all had to pull over to the side of the road while they started shaking, and each of them at the same time had this delayed stress reaction. So it didn't happen right when they were being robbed. It happened, in this case, a couple of hours later. Well, some people can often have these kinds of symptoms days later or even months later. So just notice that it can have a later onset. PTSD used to go by other names, usually as a result of how soldiers during different wars responded to scenes of intense shock or horror. For example, a term that was used many years ago was shell shock. Another term was called battle fatigue. In the American Civil War, a term was called combat nostalgia. Now, usually when we hear the word nostalgia, that means that we have a very happy feeling about something that happened many years ago, a longing for pleasant things that we experienced in the past. But here, combat nostalgia is a very unpleasant feeling where soldiers would, without seeming to be any kind of provocation, would start to remember that they were once in battle and would somehow be transported to the battlefield and start having a very vivid and intense flashback. Another term was called railway spine. Railway spine was a term given to workers on American railroads. And because they used a lot of dynamite and there were lots of accidents, a lot of people would have flashbacks. And so all of these are old terms that are not really used anymore. But today, most of these are all subsumed under the larger category of PTSD. PTSD is frequently observed in military personnel and in law enforcement and police officers. It's also frequently found to exist alongside people who have depression, transient psychosis, which means short-term psychosis, and as well as substance abuse. And there's that which we referred to in the last slide. PTSD and substance abuse are very highly correlated. The key here is that the sufferer of PTSD is experiencing intense emotional distress and that there's profound suffering as a result of this stress. So a person's life really takes a turn for the worse and they begin to function not as well because of this reaction. It affects roughly in the United States about 3.9% of the population in a given year. And over the course of one's lifetime, it's been estimated that about 7.6% Americans will have it. Among American military personnel, those who served in Iraq or Afghanistan have a roughly 12 to 20% rate of PTSD. But look at this, American soldiers who served in the Vietnam War had a much higher rate, 29%. And that caused people to wonder, why is it that soldiers in the Vietnam War had higher rates of PTSD than soldiers in the Iraq and Afghanistan wars? And what they found was that a greater percentage of the combat in Vietnam was done in close range. And so it's thought that the more that the fighting takes place in close range settings, the higher the chances of having the sufferers develop PTSD. Also, very interestingly, some researchers found that the popularity of the war, or the general support for the war, was often associated with different outcomes for soldiers. So, for example, in the United States, the Vietnam War was something that was very bitterly contested among many Americans. A lot of Americans didn't believe that our soldiers should be there. And because of that, a lot of soldiers went into the war feeling very unsupported. In addition, the wars in Iraq and Afghanistan were also very unpopular, but not as unpopular as the wars in Vietnam. And so, as a result, soldiers felt a little bit more supported going there than they did when they went to Vietnam, and the PTSD rates were slightly lower. We also know that war is not the only setting that people will experience PTSD. PTSD symptoms can happen after natural disasters. They can also result after, not necessarily when soldiers go to battle, but after has been a large attack, like in the United States during September 11th, 2001, and when there were when there was heavy media coverage of the aftermath of 9/11. Many people reported having acute stress and PTSD symptoms. So remember, when we talked about what can allow a person to be diagnosed with PTSD, remember what we were talking about, how it can't be associated with media depictions. Nevertheless, what's interesting is that some people said that they were experiencing PTSD even though they did nothing but watch media depictions of violence. And that was something that really surprised a lot of researchers. And the latest finding is that people who may be chronic victims of abuse can sometimes develop symptoms of PTSD. Now, this is a class of disorder called complex PTSD, or CPTSD. It is still not listed in the DSM, but it's thought that in the next edition or subsequent editions of the DSM that it will be included. And this is a kind of PTSD that's associated with chronic victimization. And the most common form of this is domestic violence or domestic abuse. So moving now down to number 6, slide number 6. We already went through a little bit of the name changes that led to PTSD. One of them, combat nostalgia, traumatic neurosis. We heard shell shock before, or battle fatigue. What's interesting too is that when people would go through these kinds of experiences, they suffer a strikingly similar set of symptoms and exhibit a response pattern that's also very similar. So this is the work of Horowitz from 1976. And the response names that he gave were outcry, intrusion and denial, and working through, and then completion. That all people who experience PTSD show a remarkably similar response style. There's this initial outcry, there's the intrusion and denial that a person is experiencing, then they're trying to work through and come to terms with what it is that they've experienced, and then finally, hopefully, is the resolution or the completion of their treatment. So just an interesting common set of symptoms that people would experience. Moving down now to slide number 7. Part of this cluster of symptoms include people who've been victims of sexual assault. So that would include a discussion about rape. In the United States, a very high percentage of women have experienced this. 1 in 7 women in the United States will be raped in their lifetimes. Most victims of rape are young. 90% of rape victims are under the age of 29. And shockingly, maybe not surprisingly, but this was certainly shocking to a lot of people, including myself, is that 80% of rapes were done by relatives. In the week following a person being raped, there is often enormous distress present. Now, here's this term again, distress. When you see the word distress, this is the opposite of stress. Stress is what happens when there's a lot that we have to do, and we're motivated by the idea that we have a lot to do. So sometimes we can be under a lot of stress because there are lots of expectations placed on us. But by and large, when we're experiencing stress, we're experiencing motivation and we are very active and we are moving. Distress, by contrast, refers to when people begin to fall apart and their normal coping mechanisms can no longer be sustained. So a person who is in a state of distress is a person who's not functioning well at all and their lives are beginning to fall apart. So in that week, it can be very distressing for the victim. Only 50% of rape victims seek appropriate medical care. Often because if you seek appropriate medical treatment or care following a sexual assault, that can be experienced by the victim as being very invasive. And maybe there's a part of them that is in a little bit of denial about what just happened. But anyway, only about half of rape victims seek appropriate medical care in the aftermath. Up to 30% of rape victims contract an STD, and 5% of them become pregnant. PTSD is also associated with chronic high levels of norepinephrine and cortisol, which can also lead to other disorders. So, we've talked about how cortisol is good for us when it's being secreted temporarily. It's not good over the long haul. Cortisol is associated with compromised immune system functioning and weight gain. But for the short term, when you're feeling very stressed, it can be very helpful. It's just not a good long-term solution. And of course, we've also talked about how norepinephrine is linked to happiness, but again, chronically high levels of norepinephrine can lead to other health problems. There's also the fight or flight response that happens in the absence of the fearful stimulus. And so when we were talking earlier about how people become very, very much aroused and filled with lots of tension and lots of fear, it's almost like they're exhibiting the fight or flight response when we try to decide what we're going to do when we're faced with a threat. But normally when we have the fight or flight response, we're actually facing something that could harm us. With PTSD, of course, the person is no longer facing something that they need be afraid of. The fearful stimulus is no longer there. Maybe they're triggered by something, but if a person is being triggered by something that is actually a threat, then what they're experiencing is not PTSD. PTSD is only reserved for people who, in the absence of that fearful stimulus, are nevertheless responding in a very fearful and horrified way. All right, slide number 9. Risk factors associated with PTSD include previous psychological problems, previous exposure to poverty, violence, and crime, a lack of friends or a lack of social support, and then a lack of resilience or hardiness. And so this term hardiness has been a term that's been paid increasing attention to by researchers. They think that they've been able to identify a variable or a factor that exists in people that helps them get through intense problems, even though those same problems may have been too much for somebody else. So we won't discuss that much more here, but just that has been a finding. And here on slide number 10 is a more lengthy reference to complex PTSD or CPTSD. Again, this refers to when a person develops PTSD-like symptoms or responses to a traumatic event, but not necessarily to a traumatic event that is a one-time deal and that's overwhelming, but to chronic exposure to trauma that may not necessarily be as severe. Now, that's not to say that abuse is not severe. It certainly can be, but let's say that someone is in a domestic violence situation and they're afraid of being hit, but they're not actually hit in this particular instance. That's something that is bad, but it's not necessarily something that can be as intense as going through several battles. Poverty, for example, may not necessarily be associated with one intensely bad thing. It could be associated with lots of little things that begin to add up over time. So, with PTSD, the sufferers are experiencing a lack of trust, a lack of safety, a lack of sense of self, and they also tend to be repeat victims.